The history of amputations, from rituals to modern medicine. The history of amputations dates back thousands of years. The earliest known amputation was performed on a Neanderthal about 45,000 years ago. It was done surgically, suggesting that amputations were not always for medical reasons, but rather for rituals or punishment. Amputation as a medical practice began in ancient Greece with Hippocrates, the father of medicine. He believed in amputating only when a patient had gangrene, a condition caused by a lack of blood supply. Hippocrates used cauteries and ligatures to stop bleeding and valued personal hygiene before surgery. Over 500 years later, Celsus improved the amputation procedure by cutting away part of the living tissue to make a clean cut. He also closed the wound by stitching the skin together. However, his practices still had a high mortality rate due to poor aseptics. Surgeons started using amputations for trauma, congenital malformation, and cancer. However, patients would lose a lot of blood during the procedure. To alleviate some pain, surgeons cut away some nerves, a practice still used today. During the Dark Ages, much of the medical knowledge on amputations was lost. The Catholic Church prohibited amputations, but the demand remained. Barbers, considered skilled with knives, took up the surgeon's profession, leading to poor practices and needless deaths. The invention of gunpowder and the printing press revolutionized amputations. Gunshot wounds required amputations, and the printing press allowed surgeons to learn proper techniques from books. Standardization and new techniques improved the procedure. In the early 19th century, amputations became faster and more intricate. Anesthetics allowed for pain-free operations, and antibiotics treated infections. Today, modern medicine has advanced to the point where most injuries can be treated without amputation. Amputations have a long and fascinating history, from ancient rituals to modern medical practices. It's important to appreciate the progress we've made in medicine and be thankful for the advancements we have today.